I call the San Francisco Human Service Commission regular meeting of Thursday, January 26th, 2023 to order. It is now 9:40 a.m. I am Scott Kahn, the Human Service Commission President. I would like to take a moment to acknowledge the mass shootings that have left 11 people dead and 9 others injured in Monterey Park, California, and 7 dead and 1 injured in Half Moon Bay. We are deeply saddened by the news and send our condolences to all who were affected, and I believe we're all affected, so to all of us. Elizabeth, will you do the roll call, please? Roll call.
Commissioners, please respond with present when I call your name. President Khan. Vice President McCray.
Present.
Commissioner Kogler McDonald. Commissioner Semmel. And Commissioner Singh, I see you on the screen. Raise your hand. Thank you. We have a quorum.
Item 2 is the adoption of our agenda. Are there any comments or questions from the commission regarding the agenda? If not, is there any public comment? Hearing no request to speak on this item, is there a motion to approve the agenda? All in favor? Aye.
Aye.
So moved. Item 3 is the adoption of our December 15th regular meeting minutes. Are there any comments or questions from the commission regarding the minutes? Is there any public comment? Hearing no request to speak on this item, is there a motion to approve the minutes? All in favor?
Aye.
So moved. Item 5 is our employee of the month. The commission is, oh God, I do that every month. I'm sorry, item 4 is our executive director's. I forgot, sorry.
Try not to feel slighted, President Khan. Good morning, President Khan and commissioners. I first just want to echo President Khan's remarks that he opened the meeting with. You know, Lunar New Year is normally a time of celebration and togetherness. And unfortunately, many of us are grieving the horrific acts that you spoke about in Half Moon Bay and Monterey Park. Members of the AAPI community should never have to feel unsafe when they go about their lives. And as an agency, we grieve and condemn the violence against the AAPI community, and we stand with our AAPI colleagues and community. So our agency-wide Lunar New Year celebration is going to take place next week. We also hope staff can be in community together and have a space to process with each other and during the event. So now on to my report. I'll start at the federal level. So Title 42, again, Title 42 is the act that President Trump enacted under COVID to prevent border crossings for certain categories of immigrants. The Biden administration was seeking to lift the order. It has been blocked in various levels of federal courts. The Supreme Court finally weighed in, paused the lifting of Title 42, and we'll hear it at the court, we believe, in June. So you remember, commissioners, last month and the month prior, we talked about the potential lifting of Title 42 and the potential influx of immigrants into San Francisco and our preparation for that. We continue to prepare for that, but we now have, we think, a longer runway. Again, it's not calendared yet, but we hear from our sources in DC that it's likely to be heard in the Supreme Court in June. Also at the federal level, what is called the Consolidated Appropriations Act, which is basically the federal budget, was signed late last year. It's a $1.7 trillion omnibus budget package that did have a few provisions that impact us fairly significantly. The first is the restart of the Medi-Cal Medicaid nationwide recertification in April of 2023 of this year. So if you remember, in March of 2020, due to COVID, the federal government suspended the Medi-Cal redetermination requirements under the authority given to them under the public health emergency. What the Consolidated Appropriation Act does, it decouples this, what was called continuous Medicaid eligibility, Medi-Cal eligibility, meaning the implication of that continuous eligibility meant no one would lose health insurance under COVID, right? For obvious reasons. So the Appropriations Act decouples this, meaning that we need to begin resuming the required annual redeterminations of eligibility, which looks at family size, looks at income to make sure that families, households, individuals are still eligible for Medi-Cal. So beginning April 1st, we will restart the redeterminations, and this will occur over a 12-month period. It depends on the month when the client started to receive Medi-Cal initially. We will be able to automatically recertify some of the households, some of the cases, but we estimate, our Medi-Cal caseload now is about 120,000 households, about 170,000 people. We think we'll probably have to recertify, meaning we have to process paper for about close to 100,000 of those cases. We'll do about 1/12. It averages out to about 1/12 a month, which is significant, 8,000-9,000 a month. So the state has initiated a campaign to get clients to update their addresses, which is critical because we mail out the recertification packet. So if the address is wrong, the client will never receive them. We also have entered into a data sharing agreement with the Department of Public Health and the San Francisco Health Plan to obtain the most recent addresses of our recipients, to ensure that the recertification packets get to them. The state is also requiring us to submit a county readiness plan. So the Department of Healthcare Services oversees Medi-Cal, not the Department of Social Services. We have to submit the readiness plan on February 21st. And we, of course, will be working with our internal comms group, community-based organizations to get the word out. There have already been a couple of articles in papers across the state. The state's doing an information campaign. It's just really important, as households or people got used to having continuous eligibility for really 2.5 years. It's a big shift. And so getting that message out is important, because if they don't submit the paperwork, state and federal law requires that we have to discontinue them from benefits. So the impact on loss of health insurance is obvious. There's also a financial impact potentially on the San Francisco Health Plan, because they would lose premiums for folks who are disenrolled. In a similar vein, the Consolidated Appropriations Act ended the CalFresh emergency allotment or emergency allocation. So since the beginning of the pandemic, they're called EAs, or emergency allotments, have raised each CalFresh household's regular allotment to the maximum allowed under their household size, or based on their household size. It set a minimum additional allotment of $95. In San Francisco, the average was about $150 or so per household. Keep in mind, this is about 73,000 households. So this is a significant amount of money citywide. It's about $11.5 million in benefits monthly that will be going away in April. So the last emergency allotment will go out in early March. And then we will be, obviously issuing information to clients that they'll no longer get this. So they will feel it as a real reduction, obviously, in their CalFresh benefit. Just to give you a sense of the scale statewide, and I bring this up because folks have asked, well, can't the state just make up the difference? It's $520 million a month statewide. So that's clearly, given the budget constraints, even if there weren't budget constraints at the state level, $520 million a month is not something the state could absorb. So we will be partnering with our communications team on outreach to clients, CBO partners, again, really similar to the Medi-Cal. they don't lose their benefits, but they lose that additional amount. And so they'll certainly feel it in their household budgets. We really hope to continue the community directed food support programs that you all approved earlier this year. That's $33 million in community grocery and other food supports that serve about 90,000 households in San Francisco. If you remember, through the budget in June that was passed by the board, it was basically savings from this agency's budget from the prior year that allowed us to continue that money. And so it's one-time money. It currently is not will not be in our proposed budget for fiscal year 23-24, simply because of the one-time nature of it. But we are working with the mayor's budget office. I briefed the mayor on this 2 days ago. So they're well aware of that sort of CalFresh cliff, and really just another reason to try to continue that food support in the community. So as I said, our households will receive an information letter starting next week. The State Department of Social Services is going to send automated calls and texts to those who have opted into texting. We're going to be adding an automated message to our inbound phone line, and then a scrolling message in our lobby monitors, updating our website, sending automated calls and texts to household using threshold languages as well. So Cantonese, Tagalog, Russian, Spanish. So again, two big changes in two of our two largest safety net programs that touch over 100,000 San Francisco households. So we're hoping that folks get the information that they need. There was a bit of good news in the federal act. It does make permanent the summer EBT program. So this is basically a summer CalFresh program for families whose children are eligible for free and reduced school lunch. So they get it through the summer. So they get free and reduced lunch in the form of an EBT augmentation, even though they're not in school. So that's good news, obviously. And then the act also reauthorizes TANF, which is the federal authorization for our local CalWorks program, also Title 4B, child welfare prevention programs. And then in addition, the act renewed the maternal, infant, and early childhood home visiting program for 5 more years at a total of about $800 million, which is a program we've increasingly been partnering with the Department of Public Health for our CalWorks families who have young children. So at the state level, the governor released his budget a couple weeks ago, his proposed budget for 23-24. Given the economy, the inflation, the increases in interest rates, an economic slowdown, all of those fun factors has caused a revenue slowdown at the state level, largely due to capital gains decreases, stock market losses. So the revenue picture, obviously, clearly significantly different from last year. We had an $80 billion surplus. We're now looking at about a $22-23 billion shortfall. So his budget reflects that deficit, but doesn't forecast a recession. So it doesn't dip into the state reserves. It basically, what the governor did is basically didn't make any cuts to our programs, or really any programs in the health and human services world. They're closing the gap with some pausing of initiatives that haven't started yet. A lot of stuff in the environmental initiatives, climate related initiatives, and others, other large funded projects that really don't affect us. So pleased about that. We're pleased that the state reserves aren't tapped yet, because that might be a lever that the legislature can pull if the governor's May revise does include cuts to health and human services. So we'll obviously continue to monitor this and advocate for our additions to the budget, even in the context of a budget shortfall. So a good segue into what our priorities are for 2023 at the legislative and budget level statewide. So again, CWDA, the County Welfare Directors Association, establishes their priorities as an association. We generally follow along. We generally have a lot of input over the priorities, actually. So a few areas I want to note. One is continuing to push the state for more funding to meet the needs of our what we call complex care youth. These are youth in our foster care system who've experienced significant trauma, and their needs are very complex and generally require services across multiple systems of care. The package proposes an additional $48 million statewide to help us support really deep services to a small number of kids to make sure that they can maintain their placements, make sure placements are suitable for them, and that they get the adequate complex mental health support that they need. Another area, and this is going to be the second year that CWDA is sponsoring an initiative to help counties respond to really an unprecedented number of emergencies and disasters that we've experienced over the last number of years without any state support. So, as you know, the Human Services Agency is the city's lead for care and shelter. We don't get any state money to do this. We sometimes get reimbursed by FEMA, but we don't get any state money in the immediate term. And so what the proposal does is it will provide state funding for counties to hire 5 FTE for the purposes of emergency planning and disaster response. And then we also provide counties with ongoing dedicated funding for emergency response planning, training, and community response. We did sponsor this last year. It did progress a bit in the legislature, but then stalled in appropriations. So we'll make another crack at it. On the budget side, 2 areas that we're focused on. One is around CalFresh. This is going to get a little in the weeds in terms of budget methodology, but I'll try to rise a little bit above the weeds. So basically, we haven't had a cost of doing business adjustment for administrative funding in 20 years, meaning they're basing the budget methodology for CalFresh, which is based on our caseload. So we get increases due to caseload. But when they're calculating the amount, they're basing it on costs that we had 20 years ago, staff costs, healthcare costs, et cetera, right? Which is basically we're only funded. The result is we're only funded at about 60% of our actual costs. And so in 2021, the Budget Act included trailer bill language to update this budget methodology for CalFresh beginning this fiscal year. So there's a state county work group to begin to shed light on what we have shed light to the state on what we have known for a long time, which is the costs are obviously higher than they were 20 years ago. We need a methodology that accounts for those. Counties across the state overspend their state amount. We're using county funds to support CalFresh. It should be a almost 100% state funded program. It's actually 85%, but it ends up being much less than that. So we're hoping the May revise will have the new budgeting methodology, which would result in more CalFresh dollars. If it doesn't in May, then we'll have to be advocating with the legislature and governor post May revise. And then Medi-Cal is another priority. And this is really around administrative funding to account for the increased workload for the redeterminations we're going to now have to do, which I mentioned earlier, which is a big workload increase for us. Our big workload change from what we did under COVID. All right. Within the agency, I'm going to touch on a few items. In administration, of course, we have the budget, the first cut of the budget before you today, so I don't need to talk about that. I do want to mention the activity in the emergency response and disaster preparedness group. It's been fairly significant given the historic series of atmospheric rivers and storms we had in the city. So the city's emergency operations center was activated. The mayor did issue a local proclamation of emergency on January 9th. There were 23 city and county of San Francisco departments at the emergency operations center, us being one of them. And we were there to support response efforts in collaboration with homelessness and supportive housing to track any storm-related displacements and developing contingency plans to shelter displaced households. And I'm happy to say that by the end of the response, there wasn't any significant dislocation due to flooding or due to trees or any sort of other disaster. But we were then on hand just in case. In HR and coupled with our Office of Diversity, Equity, Inclusion, and Belonging, and also, of course, our employment or economic support and self-sufficiency staff, we had a hiring fair for eligibility workers. This is one of the categories of employees in our agency where we have a significant number of vacancies. And we have a significant, as I mentioned already, a significant workload coming at us beginning in April, May. So we had a hiring fair for this classification, 2905 classification. We had over 420 potential job applicants attending this fair. This was on a Saturday and it was stormy out. So getting over 400 people coming, braving the weather and coming out to get a information packet about strategies for being successful in the hiring process, hearing presentations about the nature of the job, what the work of an eligibility worker is, what the hiring process is at the city. We had program management and staff in attendance to answer questions about the day-to-day work of eligibility staff. It was really an amazing HSA team effort with about 30 staff volunteering on a Saturday, coming out in the weather. And I just want to say, it was a great success getting over 400 people who are potentially interested in working for us. It's a very diverse group of folks, and most were San Franciscans or lived in San Francisco. I just want to express my gratitude and thanks for this HSA staff who came out Saturday, braved the weather, and contributed to the effort, which hopefully will bring in the needed staff for that division. Couple things in CalFresh. I already mentioned the emergency allotments, of course. We still do qualify for waivers for the interviewing and telephonic signature through the end of March, which makes it easier to get onto CalFresh. And then in the governor's budget, I didn't mention earlier, the one cut that's we're not going to feel because it's not implemented yet, but the governor and legislature had proposed an expansion to CalFresh for undocumented residents age 55 and older. It's through the what's called the CFAP program, California Food Assistance Program. The expansion was supposed to begin in 2025. The governor's budget delayed it to 2027, which is odd because there's no budget impact, because it wasn't supposed to come into effect until 2025 anyway. They claim it's due to automation delays and the need to have a longer runway to get this going, but it's a bit of a head scratcher. So we're hoping to get that back on track for 2025, since there is no cost implication. 3 Medi-Cal benefit expansions that happened in January. I just want to touch on real quick. Hearing aid coverage for children aged 18 to 20. So young adults aged 18 to 20. A big expansion for opioid prevention and treatment services. This is what's called medication assisted treatment for opioids. So generally methadone and other drugs like that. Detox. Yeah. Thanks, Sally. The Department of Healthcare Services ordered $52 million to providers for this treatment, really to try to expand an approach that's proven a bit successful for opioid addiction. And then the third is doula services is now a Medi-Cal benefit effective January 1st, 2023 as well. In our welfare to work division, I do want to bring your attention to the annual work we do around the working families credit and the earned income tax credit. Last year, we closed the 2021 tax year with over 3,400 clients getting additional tax refunds due to our work with them. We had over 3,600 applicants. And then this year we're starting January 23rd. So we started January 23rd accepting new applications. So this is something that's become, routine for us. It's additional work, not generally in the core of what a human services agency would do, but it's really a great benefit for our families to get help them get aware of the federal, state, and local earned income tax credits, but also help them file. And then the other area, we did see an expansion of our CalWorks housing support program in the budget that passed in July at the state level. We've already placed 73 families in housing since July 1st with that additional funding. I should note, since the program began, we've served almost 850 families in the housing support program, either through eviction prevention or through medium-term housing subsidies. In our county adult assistance program, in August of last year, we resumed the Care Not Cash program, meaning we're transitioning our homeless clients from 100% cash assistance to a combination of a shelter bed and a smaller cash grant. We've transitioned about 85% of our homeless population into those shelter beds. We have about 250 or so remaining. We think we'll get to converting all of them over the next month and a half or so. And then I do want to mention a couple of Black History Month celebrations in February. One, the agency-wide Black History Month celebration is Thursday, February 16th. It'll be in the, hopefully weather permitting, it'll be in the 170 Otis courtyard out here, but also in Bourne Auditorium here. The mayor is currently scheduled to come to hang out and say a few words. And of course, we hope to see all you commissioners here as well. And Elizabeth can provide you all with details. We're also having an in-person Black History celebration in Family and Children's Services Division, where Supervisor Shaman Walton is going to come and speak, as well as myself. And you all are welcome to attend that as well. It's February 22nd in Bourne Auditorium, and then Elizabeth has the details for you all. So that is it for me. Any questions or comments? Yes, yeah, Shaman, Supervisor Walton will be speaking to, well, it's sponsored by Family and Children's Services Division, so it'll be largely FCS staff, but other staff are welcome to come as well. And it'll be here. He came, it wasn't last year because we had COVID. 2019, I guess. Maybe 2020. Yeah, probably February 2020. Yeah, he just wants to come and say a few words. Supervisor Walton, prior to being an elected supervisor, was a good partner of HSA as executive director of young community developers in the Bayview, and so his relationships with the agency predate his position as an elected representative of us. Yeah. Okay. Thank you, commissioners.
Item 5 is our employee of the month. The commission is pleased to announce that Karina Zhang, a program support analyst with Family and Children's Services, is our January employee of the month. Karina is an exemplary employee who brings a wealth of personnel and professional resources to the table in managing her broad and complex portfolio. She has strong, effective verbal and written communication skills, analytical acumen, a tremendous work ethic, and is a great team player and always steps up when needed. Her many assignments range from in-depth work on commercial sexual exploitation of children partnerships and contracts, contact management for community caregiver and staff training and workforce development, and child maltreatment prevention work with public and community partners. Most recently, she has been deeply involved with the development of the Family First Prevention Service Act County Plan. The Family First Prevention Service Act is the biggest federal child welfare initiative in decades, with complex, wide-ranging requirements, extensive stakeholder involvement in planning in numerous areas, including budget, fiscal, and data analysis, contracts and work orders, and project implementation. Karina's role is crucial to this effort. As the assigned program analyst, she oversees related contracts, provides work group and analytical support, and collaborates closely and creatively with an extensive range of county staff and local partners. In addition to these practical supports, Karina offers thoughtful insight, critical questions, and creative ideas in different discussions and venues. She is the secret sauce, quote unquote. I'd like to know who came up with that, but she is the secret sauce in the timely development and submittal of San Francisco's prevention plan, and will continue to provide essential support as we move into implementation. Thank you for your hard work and congratulations. Going on, Mr. Ward.
So everyone understands the significance of FFPSA, or the Family First Act. for the first time, it allows federal money to be used for prevention, whereas before, federal money only flowed when we placed a child into foster care, which is sort of the reverse of what we want to do, right? We want to keep kids out of care. But along with this sort of monumental shift in what the feds will fund is a lot of requirements, changes in contracts, citywide plan that revolves a number of stakeholders to develop our family first prevention plan. We need to opt in at the state to draw down the money. It's really a big shift, certainly in federal policy, but a shift in our practice and the way that we have to account for our work. And we've been doing prevention work for a long time, but we have to do it in a certain way and document it in a certain manner in order to get the federal dollars. And so your work on this is sort of in the big picture, significantly, really important for the city and for the families and children we serve and for our agency. And so it's really nice we get to highlight that, but we also even better get to highlight and showcase your work, and thank you for that great job. So congratulations.
Thank you, President. Thank you, Commissioners. Thank you, everyone, for making me feel like this was today. Well, the thing here for me, or just for the meeting, whether you're in this room or in Zoom, I am really grateful that you're here sharing this very special moment with me. Elizabeth is me that I can take as much time as I want to do it. So I am going to take it into the offer and prolong this glorious moment. Some of you may know that I am a regular participant in this meeting, so I did quite a few of these way of month ceremonies. And when I was sitting out there, I was wondering what it takes to be standing here, sitting in the audience, and receiving the honor, and facing the commissioners. And finally, today, I know that what it takes is a supervisor who is willing to put her staff needs before her own. My former supervisor, Liz Guido, she's former manager of SPF. She just retired from over 30 years of service with HSA. And in her last month on the fifth floor, she when she was supposed to be planning for vacation and retirement, she prioritized completing this nomination process for me. And I can't thank her enough for being this very meaningful and impactful present to me. So I thank you so much. And I just learned that she's on vacation and she's still just like for me. So thank you so much. Well, of course, thank you, my first supervisor and my first director. Thank you, Tommy and Melissa, for continuing to support the decision. And I'm very honored to be standing here today. This award is such a great reminder that I've been working alongside wonderful people like you're here, who have a strong desire and ability to care about others. And that's what makes my job very special. Another important thing this award reminded me is the fact that I matter and the work I do matters. I think many of us who chose to enter the field of social services because we believe in making a difference. But as time goes by, as we get around paperwork, meetings, deadlines, we may lose focus of our mission, and we may start to doubt the meaning of our work and forget why we're here in the first place. So I want to take this opportunity as I'm being reminded today and my work members that my difference, that your work matters. When we create space to make the client feel that they matter, it makes a difference in the individual's life. When we create programs that prioritize the client's voice and choice, we are making a difference in our community. So while today may just be another work day for you or another meeting on your busy schedule, it is very precious and special moment of my life that I will treasure and replay in my head and highlight 1,000 times. And so yes, I'm very grateful. And I know I cannot count or name all the people that have helped me learn and grow at HSA in the past 15 years. But there are 3 individuals that I want to take this opportunity to give a special thank you to, because without them, I may not be standing here today or be where I'm at today. So first, I want to thank my first supervisor at HSA, Rebecca Leeds. I know she's trying very hard to be here, and I think she can hear me. Thank you for having so much faith in me and hired me to be a senior social worker when I was still a paper. And I want to thank my other supervisor that can go down and supporting me through my master's education journey, and you were able to use the helping today. So thank you, people. And last but not least, I want to thank my husband who is here with me today. Conditional love and support. He happens to be the lucky one that gets to work from home 5 days a week. Figuring out all the chores in the house. And I know I won't have many opportunities to make public compliments. So I want to make sure that I do today because he deserves it. So yeah, I'm still feeling a little overwhelmed. Since last week, I received this big surprise and I'm trying to, envision this whole I've been a whole lot of what I received from everyone today to say. So I think I have said everything I said. I want to thank you everyone for your giving me your if you have a few more minutes, we'll meet outside.
Item 6 on the agenda. Department of Benefits and Family Support's proposed budget for the fiscal year 2023, 2024, and 2024 to 2025 by Dan Kaplan.
Then Kaplan, the director of administration of the assignment. Here to first presentation.
There you go. Thank you.
Better.
Oh, better.
It is from the general description. We'll talk about city finances, mayor's budget and instruction, state and federal money, And we'll talk about caseload. I will talk about those things. Trent will then talk about program-specific information and issues that are facing us as we're building the budget. And then we'll come back and we'll talk a little bit about budget development schedule. Before I start, I'd like to say that this work of building budgets is something that really involves management from throughout the agency. So that you directly program back. All programs are involved in this. Work is coordinated by our budget team and something like those is budget directly. There are analysts who some of the team who are key in this program, Justin Chen, folks, some of the economic sports business in budget. And Jesse Rossmore focuses on the administration and the children and family and children services budget. So they are the ones who really coordinate this process. And really make this happen.
We got a request in the chat and just the podium link. Podium link instead of the handheld, just so people online can hear you better. Yes,
There we go.
that matters, but
Is this
It's on, it automatically, we just kind of have to be in the right place for them to hear it, and I can scoot it closer to the phone. Can go all the way. Yeah, I will.
all right? Thank you. Can you hear this? Yes? Yes? Okay. So so if we look at, let's go to the first slide. So we look at our budget in a number of different ways.
okay, closer.
Still closer.
Okay. Yes.
We
There you go.
I have okayed some one-time only expense to improve the acoustics in this room. And I am always reminded that that's important when I come up here to speak. So when we look at our first slide, we tend to look at the budget in a number of different ways from a number of different angles. So the first way we look at it is a program budget. And this first slide shows the budget broken out by the major programs of the agency. So I won't really talk about this. These are all programs that you're familiar with. The programs have a combination of staff dollars in them and CBO dollars and aid dollars in all of the wedges. The administration program is a little bit different because it has some agency-wide costs in it, especially relating to rent, to information technology costs, security, work orders with a number of different other agencies within the city. So that's it from the program point of view. Can we switch? Okay, we also look at the one on FTE. Thank you. So we also look at the budget in terms of FTE, full-time equivalent employees, and as you can see, the staff is spread out through the major programs. Numbers are included each, so you have a sense of how many FTE in the budget are in each of the major program areas. Let's switch. We also think of the budget in terms of what we call source, which means who's providing the money that pays for the services in the budget. And let me just mention that HSA is an agency that is funded by local, state, and federal money. So as you can see, the largest single area of funding is federal money, and that's money that's associated with a large number of the programs. So the Medi-Cal administration program has both federal and state money in it. The CalWorks program has federal and state money in it. Family and children services programs have federal and state money in it, and we have a kind of a complicated way of drawing down the federal and state dollars through a cost allocation methodology. But But what the budget staff have done here is they've grouped the money in terms of who's paying it to us. General fund is city money. And we have general funds for operating budget. That's the administration, the staffing, the running of the agency, and we have general funds in the aid budget. Aid is money that's paid out in grants or paid out to foster care providers. And then we also have money that comes through direct state grants. We have money that comes through what we call realignment funding. Realignment is a funding source that uses state sales tax money and state vehicle licensing fee money to fund social services programs. And then we have one area that we call work order recovery. And in budget speak in San Francisco, a work order is a way for one agency to provide services to another agency and money flows back and forth. So in our budget, we get about $600,000 from the Rec and Park Department for participating in a program that they have that staffs their park bathrooms. We get money from Muni for helping with their fast pass distribution. We get money from juvenile probation for having HSA eligibility workers work on the eligibility for probation department clients for Medi-Cal and for foster care. So things like that. So that's money into us. Maybe we go to the next slide. And then on this slide, we describe the sort of budget categories in which we spend our money. So as you can see, our largest single area of spending is for salaries for the 1,900 plus FTE that were on the FTE slide. We also have a fringe benefits budget for those employees. We have what we call a professional services budget, which includes things like rent that we pay for buildings, security contract costs, software licenses, things like that. We have an aid assistance budget that includes money that goes out in support of clients, but it's not a typical grant. So for example, we have our budget for our guaranteed income program is in that bucket. We have subsidies that we pay, wage subsidies that we pay for Jobs Now clients. We have a small fire displacement and hazardous housing displacement fund that we use to pay for housing for people who are displaced by fires or by hazardous housing conditions. So that's what we would do in there. Aid payments is a major category, and that's CalWORKs grants, foster care payments, things like that. CBO grants you're familiar with. Many CBO contracts are brought to you on a regular basis. That's where we budget those. And then we have other support and care where we basically have our working families credit budgeted. We have materials and supplies. That's just stuff we buy for the running of the agency. And then we have a capital budget where we pay for small capital improvements, the buildings that we occupy. And then we have a work order budget too, where we pay other agencies to provide us service. And this is actually a relatively large amount, $85 million. So we buy $20 million of child care services from the Department of Early Care. We buy $18 million of public health services from DPH. We spend $9 million on rent of city-owned buildings. We have our workers' comp charges in there. We have our Department of Technology charges in there. We have our city attorney charges in there. So we can go to the next slide. Those are the major components of the budget. This slide attempts to describe the situation that the city finds itself in for budget making purposes at this time. And the bottom line is the cumulative deficit line at the bottom of these slides. And what you will see is in fiscal year that in the budget year, we are looking at a $200 million deficit, and in the subsequent year, a $500 million deficit. And what that means is that the city has to reduce costs somehow in order to bring in a balanced budget. Can we go to the next one? So what's driving this situation? And you know, there's been a lot of talk about this. Trent has talked about this on a number of occasions before this commission, but basically we have a weakening revenue outlook compared to what was expected in the past. That comes from very high office vacancy rates in the city, slow downtown recovery, and it also comes from the drying up of federal one-time monies that the city had during the pandemic to support pandemic response, but also to make up for revenue that the federal government expected municipalities would lose during the pandemic. So those one-time monies are really ending now and are not available. On the cost side, we are in a time of relatively high inflation. The most recent city contracts allowed for relatively good increases for worker wages. They were 5.25% this year. They will be a little bit less next year, but close to it. There are increased pension costs for the city because the market's downturn in calendar year 2022. And there is the sort of the general increase in costs that the city is facing for all programs. So what the mayor's office has done is it has asked agencies to propose 5% reductions in the budget year and 8% reductions in the year after the budget year +1. And these are reductions to 5% and 8% of the discretionary general funds in an agency's budget. So, you know, our total budget is over $1 billion, including federal, state, and local monies. The 5% is computed on a small share of that. So for us, the cut target is $2 million in the budget year and $3.2 million in the budget year +1. And that's a reduction in the city general funds that we would be drawing. The mayor has re-emphasized her existing priorities, which are around supporting the recovery of the local economy, improving public safety conditions, reducing homelessness, and, you know, continuing to be accountable in delivering the services we're meant to deliver. Next. So Trent spoke about the state budget situation, so I won't do that. But, you know, the bottom line for us on the state side is that the budget, although it has a fairly large deficit in it, really doesn't hit human services programs. They continue at roughly the same level. There are always puts and takes in the state budget as well as our own, but on balance, we are in a slightly improved position from state revenue compared to what we were in the current year. And then the last thing I want to talk about before turning this over to Trent is caseloads. And staff have pulled together these representations of the caseloads in our major programs. And what you can see, if we go through them, is looking at the Medi-Cal program, we had a huge increase back when we did the Affordable Care Act. Then we sort of drifted down for a number of years. And then when the pandemic started, the caseload went up. And it went up for a number of reasons having to do with the way we review cases and the fact that people were dislocated from their jobs and qualified. So caseload went up. And we are right at the point where we're going to, as Trent said, start getting out of the pandemic-related rules around Medi-Cal, and we will expect the caseload to start going down in the near future. For the CalFresh program, if we look at time, we sort of went along flat for quite a few years. And then in 2019, our caseload started to go up when we did the SSI cash-in. So people in California who were on SSI were previously ineligible for CalFresh. In 2019, they became eligible. So we had a big increase of caseload, getting the folks who were on SSI onto the CalFresh caseload. But then during the pandemic, the caseload has continued to rise. A little bit of that is still the SSI cash-in, but a lot of it is that dislocations in the economy and many people becoming eligible for CalFresh. And we expect that trend to continue, that caseload to continue to grow. When we look over at the CAP and the CalWorks caseloads, you'll see both of those caseloads were coming down for a number of years. Those caseloads are very affected by the economy. And as the economy was very strong going into 2019, those caseloads came down over a long period of time. And then you can see when the pandemic hit in early 2020, the CAP caseload spiked up right away, and then it came down very quickly. And the reason it came down, we believe, was that during the pandemic, there was a lot of federal benefits, especially federal pandemic unemployment insurance, that allow people to have income from other sources who would otherwise have been on CAP. And that low caseload went through the pandemic until the autumn of 21, when the pandemic benefits ended. And then you can see the caseload has come up rather precipitously since then. For CalWorks, the caseload came down for many years, but when the pandemic started, caseload went up. And the last caseload that we always track is our foster care caseload. And you can see that that was largely unaffected by the pandemic. It's been going down for many years due to practice changes, demographic changes, etc. Okay, I'm going to turn this over to Trent, and then we'll pick up at the end with questions.
Thanks, Dan.
So next slide. So Dan walked through a lot of numbers. I'm going to talk to you about the programs and services that are sort of, I don't want to say behind the numbers, in front of the numbers. Maybe that the numbers fund. How about that? So I'll just sort of go by division here and highlight sort of over the last 6 months in the current year, and then of course looking forward into the budget year. In San Francisco Benefits Net, SFBN. So this is our CalFresh and Medi-Cal enrollment area. I've talked this, Dan just talked about it, the caseload rise due to a lot of factors. A big one, and one that I'm very pleased about, is the state's continued expansion of Medi-Cal to undocumented residents of San Francisco, first age 50 and above in May of 22. And then a planned expansion of age 26 to 49 in January of 2024. He had, prior to the expansion of over age 50, already expanded up to age 26. So basically, come January 24, if you are low income and you live in San Francisco, you are eligible for Medi-Cal, irrespective of your status, which is fantastic. It does have an impact, of course, on caseload, but it's an impact that we're more than pleased to deal with. I mentioned already the pandemic waiver on processing Medi-Cal eligibility goes away. We will have to begin doing this redeterminations starting in April. Significant increase in workload because while we're doing all the redeterminations, we still have more applications coming in. So it's sort of a doubling of efforts by our eligibility worker staff. I'd mentioned we have a lot of vacancies, so we're taking various steps to address the workload, including bringing back some retired employees to do that work specifically. Significant increase in our CalFresh grants due to the emergency allotments. I already mentioned those are going away, and the last benefit will be in March of 23. The monetary loss to the city is about $11 million a month, which I think will certainly be felt in restaurants for those who use CalFresh in restaurants, but our corner convenience stores and even our bigger supermarkets, $11 million is significant when you think about the entire prior to COVID. The monthly CalFresh expenditures was about 19 million. COVID added 11 million. It's going away, so it's about a third, which is big. Next slide, please. So one of the there were several sort of, I don't know if I'd say unintended, but positive sort of byproducts of COVID. One of them was certainly providing shelter-in-place hoteling for thousands of homeless, the bulk of whom are now in some sort of permanent housing support. But another one was taking advantage of the fact that individuals were in a fixed place who aren't normally are homeless and on the street. We did we called Homeless Benefits Linkage, which is providing outreach eligibility workers at our shelter-in-place hotels, SIP hotels, at our congregate shelters, at our safe sleep sites. And we, as a result, since 2020, when we started this, almost 2,000 CalFresh applications among homeless individuals, which is, and 93% of which were approved. About 1,155 CAP applications, about a third of them were approved, and then 1,300 Medi-Cal applications, over 88% approved. So being able to get largely homeless individuals, some homeless families onto benefits that they're certainly eligible for is a positive outcome of sort of the situation we were in under COVID. And then we also formed, and this is subsequent to the outreach, multidisciplinary teams, along with the Department of Homelessness and Supportive Housing, to bring those eligibility services directly to people experiencing homelessness, again, coupled with the work that HSH is doing. Next. And then for the third area, so, Commissioner Khan or President Khan often has said, so this new Department of Homelessness and Supportive Housing was created. What does that leave us to do? It's really still quite a lot. And this is sort of the highlights I'm talking to you about. We still do a lot of work, provide a lot of services to our homeless residents in San Francisco. Another one being the Homeless Disability Advocacy Program, or HDAP. This is a state-funded program that provides housing supports and additional supports for disabled homeless individuals to apply for federal SSI. And receiving federal SSI, of course, significantly increases their income. It also provides them an avenue towards housing while they're going through the application process. The theory being, and it's the theory that has been proven, that if someone's in stable housing, the likelihood that he, she, or they get approved for SSI is greater because it's a fixed address. We know how to contact them. There's lots of paperwork and appointments, etc. So we placed 189 clients in permanent supportive housing, and 117 of whom have been awarded SSI already. And a lot of those remaining are still pending. Next slide. So in our County Adult Assistance Program, or CAP, we have seen a significant increase in the homeless CAP caseload over the past year. I think this is largely due to the pause of Care Not Cash, or the pause of providing shelter in lieu of cash assistance. We did see an increase in individuals applying for homeless support. I've talked often years ago about the nature of the CAP population and sort of the migration patterns of single adult homeless from county to county. When you look at Alameda County's and San Mateo County's general assistance offerings for homeless, it's very, very low. Much I don't know what Alamina's is now. It was $25. I think it's more now, but it's nowhere near the $600 that we provide. And so I think you do see some attraction to San Francisco from folks who might be living elsewhere. That is part of the increase of the caseload. And so we saw it go from 604 in January of 2020. We paused the CAP benefit program or Care Not Cash. In March, April of 2020, we saw the caseload increase to about over 1,500 by August 2022. We have since resuming the offering of shelter instead of a full cash grant. We have seen that tick back down. The maximum, and we anticipate it further decreasing as we continue to offer that. On October of 2022, because our CAP cash assistance grant is pegged or linked to the CalWORKs grant, in that when CalWORKs gets an increase, CAP also gets an increase. The grant increased for GA to $556, and to the 3 other CAP programs, Pay as Sip and Calm, to $687. And then the last bullet notes what I just said. Next slide, please. Okay. CalWORKs, the state shifted from a 48-month time limit to a 60-month time limit starting in May of 22. That's good news. It allows us to work with families for a bit longer to get families on track to hopefully employment or more stability before their time clock goes out. It's important to note that even when they hit the 60-month, the family does not get discontinued from aid. What happens is the grant decreases because the parents' needs are taken out of the grant calculation. So the grant decreases just to essentially support the children. So it counts the number of children for the household size to dictate the grant amount rather than the adults. So they remain with us. It's just they get a lower grant, and this is something we don't control. This is a state law, not local. The governor, similar to the addition of the Housing Disability Assistance Program, HDAP for single adults, the governor expanded the CalWORKs Housing Support Program, which I mentioned in my report earlier. We got an increased allocation of over $11 million in both fiscal years 21-22 and 22-23 to be spent up through the end of June 2024. The allocation, however, will go down beginning 23-24 unless the state re-ups it. I'm not anticipating that will happen. And so our annual allocation will go from 11 million down to 5.4 million. So we're going to have to assess sort of how we adjust the service delivery on that to account for that loss of dollars, whether that's shifting general funds or whether it's scaling back some of the one-time supports through that program, like one-time eviction prevention payments and things like that, but also potentially exiting families off of their subsidy that's funded through this program into the homelessness and supportive housing department's system of care, freeing up dollars to either serve more families. But if we see a reduction, probably just, not backfilling those dollars, just exiting folks in the program in a positive manner. And then also of note, given what's going on in Eastern Europe and Ukraine, we have seen an increase in our refugee caseload, 155 cases in November of 22. Refugee families who are designated refugees or asylees by the federal government are eligible for CalWORKs, unlike undocumented families who are not, whose parents are not eligible for cash assistance. I note this just because of the impacts of Title 42 in June, that we could potentially see a further increase of our refugee caseload, which it's certainly an increased workload. I think it's an increased workload that we welcome, in that we're able to provide supports ranging from cash assistance and even housing support for some of our arrivals. And so it is something that we're tracking more than we would have historically. I mean, you see that in fiscal year 21, we only had 13 cases a month. So, I mean, it's there to be monitored and tracked budgetarily. Workforce development, next slide. We are anticipating an increased demand on our employment services as the pandemic relief aid programs and as, sort of the economy, even though there's a 2% unemployment rate in the city, there still are a lot of people seeking employment, people who are re-entering the labor force who aren't calculated in that unemployment rate because they have exited the labor force. So as they re-enter, we're there to support their employment services needs. An example, our participation rate for our Jobs Now public service trainee and wage subsidy programs is about half now of pre-pandemic levels. Yet in the budget, we are anticipating fully funding the program so we can enroll people into those Jobs Now wage subsidy, so private sector wage subsidy programs as well as public sector positions. And then speaking of the public sector positions, 30 additional career pathway positions. Career pathway positions provide exits from the public service trainee Jobs Now program into positions in city government, into positions at Rec and Park or DPW and largely human services, which I think is not only good for individuals who we place in employment, but it's really good for the populations we serve to have individuals who have had lived experiences of being on human services agency assistance and programs, reversing that and being there to serve individuals and families who are seeking our support. And then something we launched during the pandemic, providing services aimed at bridging the digital divide. This became so clear during the pandemic when everything turned online, job search, interviews, everything became online. And if families, households didn't have access to broadband, didn't have.
Yeah, but how do you know which one is specialized in that kind of property? There's no way to tell.
Commissioner Singh, I think you need to be on mute. Thank you. Okay, where was I? I was on a roll.
Crazy.
Oh, digital divide, okay. Families access to Wi-Fi or Wi-Fi access to devices, iPads, laptops to be able to engage in the economy and in what was going on in our lives during the pandemic. And so providing those directly to our families who are on CalWORKs. Assisting undocumented, we have a pilot of 100 undocs to provide sort of case management support, but also to think about pathways into employment for undocs who can't necessarily work here legally, but there are still opportunities through contracted employment and others that we want to get our undoc neighbors into. And then removing hardship barriers and providing incentives to participate. So literally cash incentives to families to complete certain components of CalWORKs and get back on that path towards finding a job and moving towards improving their economic conditions. Next slide. Okay. So Family and Children Services, we mentioned with our Employee of the Month, or I mentioned the transition from the Title 4E waiver. I didn't mention the waiver in my remarks, but the transition from the 4E waiver to the Family First Prevention Services Act, or FFPSA. Under the 4E waiver, for 5 years, we received a fixed amount of federal dollars, irrespective of the direction that our caseload moved. Because our caseload was declining in foster care, that meant more money to provide supports for prevention activities, other wraparound services, and additional services and supports for families. When FFPSA passed, the 4E waiver authority was eliminated at the federal level, which meant that we saw we projected this, but we experienced a funding gap, a funding loss. We had a fixed amount of money for a caseload that was projected here that ended up being here. Sort of that delta we need to account for through actions of our budget team and some program adjustments. We're able to counter that deficit without any significant service loss or staff loss. And now we transition into Family First Prevention Services, which allow, with a lot of contingencies and a lot of strings and a lot of sort of T's to cross and dots to I's, we can bring down federal dollars for some of the preventative work that we had funded prior with the 4E waiver dollars. Not trying to confuse you, but it's a little complicated. But in a nutshell, using those federal Family First Prevention dollars to fund a robust set of prevention activities citywide to keep kids out of foster care. And then with that, there are a set of sort of criteria that programs need to meet in order to be eligible for the federal money. So we're looking at how to modify our programs to maximize the dollar drawdown. This is why she was Employee of the Month. It's not easy to do. And then also as a byproduct or a function of COVID, the state wisely paused the exiting of foster youth from our system if they chose to remain with us, meaning when they hit age 22, they would exit extended foster care. But under COVID, we didn't want to exit. We we want to continue the financial support for our young adults who are in foster care. And so as of December 31st, 2022, that ended. And so we did have, because we weren't exiting, so we had this kind of larger group of non-minor dependents, 127 of them, I believe, who exited in January of 22. And so what we did is we did sort of this cliff that was created because we held them in care. We wanted to make sure that cliff wasn't didn't manifest in sort of a drop off of everything that we were trying to support them. And so we kind of tried to shallow that cliff out by providing kind of bridge housing subsidies and support and bridge support for those youth up through June to allow, you know, sort of us to catch up in terms of our services and have them exit with a plan, with either a plan for a job, housing, education, or a mix of them. And so we did augment housing supports with some one-time dollars in order to do that. Next. I mentioned this in my report, addressing the needs. It's a small percentage of our foster youth, but it's a small percentage that really consume a fair amount of staff time, services, and dollars. They have extremely complex needs. They've suffered significant maltreatment, significant trauma. Bless you. This trauma manifests itself in sometimes difficult behavior, resulting in being exited from placements, requiring those who do care for these youth additional wraparound supports for the caretakers, additional supports for the kids. It's very expensive. The state has finally recognized what we've been saying for years, that they need to fund this at a deeper subsidy level. And so we're partnering with CWDA, partnering with CDSS to continue that funding for complex care, which basically allows us to pay upwards of $12,000, $13,000, $15,000 a month to support a single child in care. We also, again, the governor recognizes the need for housing and homeless supports across the whole continuum. I talked about HDAP for single adults. I talked about the housing support program for families. We also have the state-funded Bringing Families Home program, BFH. Everything has an acronym. The idea around Bringing Families Home is for parents who are ready to reunify with their children, but who are homeless, and that homelessness is preventing that reunification. Bringing Families Home provides housing support for those parents to get their kids back reunified, get them out of foster care. So it saves dollars on the placement side of foster care, better outcomes for families, and that program, again funded by the state, is something we actually piloted prior to the bigger state dollars to provide that support for our families. As you know, and I've mentioned before, the number of families experiencing homelessness in our child welfare system is growing. It's not surprising as the homelessness problem in San Francisco persists. Important to note, though, that homelessness in and of itself is not a criteria for bringing kids into the foster care system. And there has to be maltreatment, neglect, harm, not simply homelessness. But nevertheless, when that happens, we do have the wraparound support through BFH to help. And then this is something we did a couple of years ago, but it continues to be in our budget. We used to operate what was called the Child Protection Center, or CPC. This was a 23-hour short-term placement at the Edgewood campus for kids. When we remove children from their parents, we would bring them to the Child Protection Center to await a placement somewhere else. What would happen very often, it basically looked like a full shelter, had beds, kitchen. The licensing only allowed us to keep them 23 hours, but very often kids would stay longer. So it was becoming sort of a de facto shelter for kids, which is sort of study after study shows it's just not a good environment for children, especially after suffering trauma from being abused or neglected to the point where we have to remove them from their birth parents. So we shifted away from the CPC model and we closed it. We shifted to a network of emergency foster homes, which are foster parents who agree to take in kids at a moment's notice to provide them immediate placement into a family environment and not a congregate shelter. And so we operate, I think, 10 emergency foster homes through partnership with Alternative Family Service, or a foster family agency. That will continue in this budget, and really has shown you approved the contract before the commission. I think I even mentioned at the time what a great partnership it is. It's really much better for kids to not have that short stop at a shelter and go right with the family. Next slide. I think Okay. So program support administration, I won't take a ton of time on this, but just note that, HSA, or the reason HSA was formed back in 2004 or 5 was to have an administrative infrastructure support two departments. The Department of Benefits and Family Support used to be called Department of Human Services, the Department of Aging and Adult Services, which is now the Department of Disability and Aging Services. The administrative infrastructure supports both. So way to save money when we're going through budget deficits in the new civil administration. I just want to mention what the administrative infrastructure is. It's planning and policy, communications, our budget team, of course, contracts, finance, human resources, information technology, facilities and operations, investigations, and disaster preparedness and emergency response, which is so obviously it's a huge division. Just want to note a few highlights within the admin division. In HR, I mentioned the large number of vacancies. We're probably sitting at about 400 vacancies right now, 2,400 FTE. So that's, let's call it 18%. Highest it's been in my tenure, certainly. So we're working on speeding up the hiring process and onboarding. You may have seen in the Chronicle yesterday, the Civil Service Commission was poised to approve, and I think did approve, a series of reforms to speed up the city hiring process. The vacancy rate we're experiencing at HSA is really similar across the city. Departments facing 20% or more vacancies. The report noted an average time to hire or time to fill a position of 250 days or something like that, from the time a position is vacant to the time it's filled. That's just untenable. And so the notion of that these reforms will cut that by more than half is most welcome. We tracked less than that, but that was a citywide average. And then it continued, the Office of Diversity, Equity, Inclusion, and Belonging, DEIB, continues to be a priority for me and for our leadership team. We're expanding our diversity recruitment efforts, providing racial equity training to all staff and to you commissioners, and we're hosting multiple racial equity town halls to really continue to reinforce the importance of addressing racial equity, both internally as well as externally. Next. So in IT, probably the biggest IT undertaking will be the transition to CalSAWS, which is the new information system for our benefit support programs. We transition in October of 23. There's a lot of prep to be done, a lot of change management, a lot of sort of business process reengineering to ensure that our business processes are supported by the new system. That's going to be a statewide system. So lots of changes and lots of work and focus, not only on IT, but also in our program divisions, of course. In facilities, the 170 Otis building, I've said is, it doesn't meet current seismic safety standards. It doesn't mean it's going to collapse. It just means the standards are much more rigorous than they were when this building was built. So we're working on potentially relocating out of 170 Otis. That continues to be top of mind, as well as getting a permanent presence in the southeast section of the neighborhoods in the city. Our offices at 1800 Oakdale closed. This is our workforce development and benefits offices, and we're looking to reestablish ourselves in the Bayview Hunters Point 94124 neighborhood. Our communications team, we did our new branding effort, sort of emphasizing our commitment to San Franciscans and sort of our no wrong door approach, meaning we'll sort of meet you where you're at and serve you at multiple sites. A lot of other projects, communications is taking on a continuation of our foster care recruitment, foster parent recruitment efforts. Another big one, which I mentioned earlier, is the messaging to clients and our community partners around the changes in our CalFresh and our Medi-Cal benefits, benefit processes. Disaster preparedness. We are winding down our shelter-in-place hotel system. It was at the end, I think 28 hotels. We have now demobilized all of them. There's no one living in any hotel anymore. We have about 4 more that we're negotiating with still on settlement costs. So repair costs for what's called loss of use, meaning while the repairs, they can't obviously book their hotel rooms. So hopefully by the end of this fiscal year, the book will be closed on the massive shelter-in-place system that we put in place under COVID. And then the other thing in disaster response, when we have a fire at that displaces dozens of people, and it happens a lot, unfortunately, or we have other needs to open an emergency shelter, we generally have to, I don't want to say scramble because it sounds like we're not prepared. We are prepared, but we generally have to identify a shelter pretty quickly. Sometimes it's a rec center, sometimes it's could be a church. What we're looking to do is to find a permanent temporary shelter, if that makes any sense. So a permanent location that we could activate when we need to open a congregate site for people who are displaced. We've identified a site that needs some remediation to be able to be used for that. And so what we do is we secure that site. When it's not in use as a shelter, we would use it for other things like trainings, disaster preparedness trainings, and open it up to other cities to do other city departments to do that. But it just makes a lot of sense to cut out that sort of step of trying to identify a shelter when we have so many other pressing needs of helping people who are displaced. And so that is something we hope to have in place, and it would be funded in the budget. Next. Last but certainly not least, I mentioned the importance of food support, particularly in light of the reduction in CalFresh benefits that we're going to see in April. Inflation persists, food costs a lot more than it did prior to the pandemic. There's certainly the need in our communities that continues. We've invested $33 million in the current year. Again, I mentioned it was one-time dollars. We've reached, I said 90,000. The slide says we've reached almost 100,000 San Franciscans with 1.3 million grocery bags, 220,000 hot meals, and then vouchers for groceries for families to shop on their own. We're going to be tracking the increase, what we think is going to be an increase in demand once the CalFresh benefits go down. So we'll be tracking that in April and May, and hope to make the case to, well, we're trying to make the case now, but this would sort of buttress our arguments to the Marriage Budget Office and the mayor herself, as well as the Board of Supervisors, to continue the funding for the $33 million into the next fiscal year. I think that might be the end of me. Yes. Okay. I was joking. I'll be here for a little bit longer. I'll turn it back over to Dan to talk about the timeline. Unless
just one, is it possible for us to hear how the multidisciplinary teams have been working as they come to their first year anniversary?
Cindy Ward from our she used to work for us. She went back to HSH. Now she's back for us. She coordinates those efforts, and she could come present to you all if you'd like. It's a neat partnership, and given the leadership at HSH used to work here, the partnership's made easier. But when it gets down to the staff level, it's great to have that, importance of everything that we do be linked to their population. So yeah, we'd be happy to have a presentation for you, Commissioner.
Then my second is more just, is this a place where we ought to make a shout out? And I'm just wondering that as we transition these hotel rooms back into the commercial market, has there been a benefit to those owners as the pandemic was reducing room utilization for them? And if so, how do we champion that in that way we were helping the businesses stay alive, not just taking their rooms? Okay.
We provided, I don't know what the number ended up being. It's probably close to $400 million into the hotel industry that they otherwise would not have received, right? So they benefited a lot, right? But they also helped us. They helped us house over 3,000 homeless individuals. The reason I'm smiling is because several hotels are going after us for very large sums of money to repair their hotels and claiming loss of use. We're talking tens of millions of dollars. When we were in a closed session with the Board of Supervisors, although I can't legally disclose what was talked about, I can tell you that the tone and the tenor of the board members, many members, were incredulous that they would go after us for sometimes frivolous claims after we propped them up with $400 million of money. So we're sort of in an odd place where we want to thank them, but we also want to have them exit gracefully from the program that we partnered with. So I think we'll hold on any sort of thank you until we're closing all up.
Public hears is, this is what we've done to their establishments and that's not, anyway, that I was just.
Those were very old, were needed were needed refreshing before we entered them. And the feeling from some is that they're trying to refresh on the backs of the city dollar, and that's not something that we're taking very well, nor is the elected nor are the 12 elected representatives of the board in room 200. Well, the press loved it. Look at all the damage we did. Yeah, I know.
We should say that. In this process.
Some exited very gracefully and have thanked us, and we have in turn thanked them and negotiated settlements that were entirely reasonable. But there are a handful that are not being as reasonable.
Just to finish up here, this is a process, as you know. This is our first step in the public process. We'll be back in front of you on February 15th. We will be submitting a budget to the mayor's office on February 21st. And then there will be many discussions between the agency and the mayor's office over the next several months, which will result in the mayor's budget for HSA, which will be released on June 1st. And then we will go into board hearings. Those will take place during June and end pretty much right at the beginning of July, and the board will then pass a budget and the mayor will sign. So we'll be back again in a few weeks, but then the process will go on from there.
Thank you very much. 641 million.
It's over $1 billion.
Yeah. Mhm.
Elizabeth, he has to comment on it. Look, Carl.
Morning, Commissioners. Carl Kramer, San Francisco Living Wage Coalition. The Consumer Price Index increase for this last year, which is what's commonly used as a measure of inflation, was 5.6% for the greater Bay Area. For low wage workers, that is more than $1 wage cut. And it doesn't reflect the things that low wage workers spend money on. You look at the markets here in the Mission, tomatoes went from 99 cents a pound to $1.99 a pound. Oranges went from 99 cents a pound to $1.99 a pound. Chicken is now at $2.99 a pound. You know, this isn't a budgetary pinch. This is a financial crisis. And there's 3 groups of low wage workers that you can help. There's IHSS home care workers, and 5.6% increase for them would bring them up from $8.75 an hour to $19.80 an hour. And that should just be a minimum. Home care workers are now saying they need at least $25 an hour. There's the city-funded nonprofit workers. Think about the people working in the homeless shelters, providing services to the homeless. The increase would be from currently the minimum $17.90 an hour to $18.90 an hour on July 1st. That'd just be the minimum. I mean, all of them should be provided a CPI increase. Now for home care workers, the mayor's budget instructions did mention a CPI increase for home care workers. And again, that should just be the minimum. Then there's also a 3rd group of workers, parents who are in the welfare to work programs. They're working for their public assistance. And many of them are working at the nonprofit organizations that are providing essential services to the residents of San Francisco. They're part of the social infrastructure of this city. And the budget deficit should not be balanced on their backs. They have too many burdens as it is. Thank you.
I'm a CalWorks recipient and I have been for a while. Okay, I'm shy. I'm sorry. I didn't know.
There you go.
Okay, and I do appreciate, since the pandemic, I've been through the homeless and the domestic benefits with CalWorks, which has been beautiful to me. Now they just have, I don't know why I'm crying. But they just reinstated with jobs now. And then it's so beautiful to me, and the wages need to stay that way. You know, I don't know why I'm emotional right now. But being reinstated into jobs now have really made my life turn around, you know, from being in domestic violence and going through homelessness and not knowing where to go. And I do appreciate CalWorks. I do. And the wages, and thank you for the extra wages and money too, and I appreciate you, and thank you.
Thank you.
Thank you.
Moving on to agenda item 8A is the resolution to hold in-person meetings with some members possibly appearing remotely. Are there any comments or questions from the commission?
So move.
Is there any public comment? Hearing no requests from the public to speak on the item, we will close public comment. Is there a motion?
So move.
All in favor?
Aye.
So moved. 8B is a request for authorization to approve the 59th County Letter of Agreement with the California Department of Social Services presented by Joseph Wang.
Okay. Good morning, President Khan and commissioners. This is okay?
Yeah.
Okay. Okay, no problem. So. Yes, this is a, you need me to read the whole thing? No, okay. It's a very long request. David Conley. Good. So I'm here, I'm Joseph Wong, I'm the HSA Finance Director. I'm here to present this request. To explain this request, I'll start with talking about the history of 2011 realignment. 2011 realignment was a legislation by the California legislature to shift funding from state funds to these dedicated fund sources, sales tax and vehicle license fees to counties. So basically before this affected 7 programs statewide. This is affected APS, Adult Protective Services, Adoptions Aid, Assistance Payments, Adoptions Administration, Foster Care, Assistance Payments, Foster Care Administration, Child Welfare Services, and CAPIT Services, which is Child Abuse Prevention, Intervention, and Treatment Services. And so previous to 2011 realignment, all these programs received state funding, and they received the state funding as a percentage of costs that the counties incurred. So if the counties incurred a certain amount of cost, they would receive a percentage of state funds. With realignment, these dedicated funding sources funded the counties without regard to the costs. So it decoupled the costs from the funding. So if the county's costs go down, the funding was dependent on the amount of state sales tax and vehicle license fees that were collected statewide. So the problem with this, one of the problems with 2011 realignment was that when they did this, they didn't realize that some of the services were actually, some of the costs were borne by state contracts. for the counties. So when it was realigned, the state contracts were still in place, but they had no revenue because the state weren't receiving realignment of dollars. So to fix this situation, they created this entity called the 59th county. And so the 59th county was created in order to receive the dedicated funding. And then they could then pay the state with this funding. So when it was first initially created in 2011, Santa Clara County was initially the first county that represented the 59th county, and they did it for a couple of years. But then they had a change in leadership, and so they decided to back out of it. And when they did that, the state came to San Francisco and said, "Hey, can you guys take over?" So for those of you who were here in 2015, you will recall that I presented this back then to begin serving as the 59th county. And so for the past 8 years, we've been doing this. And so this request is just to continue doing this ongoing. And just to provide some history of how it's been happening, we've actually, the fund itself has actually accumulated quite a huge balance. Initially, the contracts from the states were worth about 30 million a year. And so they were expecting funds to be about at that rate. But we've received a lot more funds through the years because of the really good economic environment. So as a result of that, I think the fund is now at about 40 million. And so, and the contracts that they are proposing for next year is at about 17 million. So I think we can definitely go on for several years at this rate. But anyway, so that is the request in a nutshell, that we continue serving as the 59th county. And then each year, the state will give us a new budget of how much they want us to fund, and we'll continue just processing it. And so all the funds actually go into a fiduciary fund that we have no access to. All we do is receive the funds as a 59th county and then pay the state when they pay their statewide contracts. If you have any questions, I'm here to answer anything.
Any questions from members of the commission? Any public comment? Having heard, we'll move forward. Thank you.
So move.
All in favor?
Aye.
So moved. So I have to go back to item 7. I missed the consent calendar. So do any of my fellow commissioners want to remove an item for individual discussion? Is there any public comment? Hearing no further request to speak on the item, is there a motion to approve the consent calendar?
So move.
All in favor?
Aye.
So moved.
Hi, good morning.
Hold on a second. Item 8A is the resolution. Well, we did that. Now we're at, we just did Joseph and now we're on C. 8C is a request for authorization to enter into a new contract agreement with Evident Change presented by Melissa Conway.
Morning. My name is Melissa Connolly, and I'm a program director with Family and Children's Services. I'm here on behalf of the Department of Benefits and Family Support to request authorization to enter into a contract with Evident Change for the period of February 1st, 2023 through June 30th, 2024 in an amount of $200,000 plus a 10% contingency. So not to exceed $220,000. The purpose of this contract is to conduct interviews, focus groups, and case reviews on Family and Children's Services cases to identify strengths and areas of improvement for us in our post-investigation case carrying units. So this contract is a follow-up to a case review completed in 2021 that focused on intake and investigations, and this carries that forward to the rest of our system. This will focus on what's known as the back end of our system and allow us to have a comprehensive review across all processes. We're going to look at supportive transitions, family services, and the court dependency units. And then upon completion, we will work with the vendor to develop implementation plans and address improvements. Matt Younger is here with me today. He will provide oversight of this contract. And we also have Diana Kupisk from Evident Change, our proposed vendor. We welcome any questions you might have about the project.
Comments or questions from the commission? Is there any public comment? Hearing no request to speak on the item, we will close public comment. Is there a motion? Is there a second?
Second.
All in favor?
Aye.
So moved. Thank you. Thank you. Going on, Elizabeth.
Item D. Do you want to have I know, do you want a speech about why they should vote for you?
I nominate Han to continue as chairperson of the board, the commission.
And we need somebody to make a comment about vice president. So I would recommend Reverend McCray.
I was gonna go through formally and ask the
We'll vote, but can we do this casual? Yes, thank you.
So let's start with the.
Re-election of President Khan, Commissioner Summerall, yes or no?
Yes or no? I'm voting for me for president.
Yes or no for president for?
Yes.
Yes.
Commissioner Khan,
Yes.
Commissioner Ray,
Yes.
Commissioner Sneed. Thumbs up again,
Okay, great.
and yourself. Okay, you are.
All right, Mr. President. All right.
For Reverend McCray for being vice president. She already made the motion. Say ditto. You know?
Commissioner.
Yes.
Yes.
Commissioner Sneed.
Thumbs up.
Okay, as Vice President? Commissioner McCray, you vote for yourself?
Yeah.
Okay, wonderful, thank you.
The last item on our agenda is public comment. Is there any public comment? Hearing no request for public comment, our meeting is adjourned.
Thank you, sir.